Well, hello, everybody. Jackie Paige back with another edition of Girl Talk Live. Really excited to be back with you. We're going to continue our conversation about a very intimate topic. We've talked about this before, but it affects women of color more than it affects anybody else. So we had to bring it back. We have to talk about it again. I'm talking about fibroids. We've had this conversation before, but we want to talk about it a little bit more in depth. I cannot have this conversation by myself. I can't do it by myself. So with that being said, I want to bring on Dr. Lawrence Stitt III. Dr. Stitt, how are you?
Wonderful, Jackie. How are you this evening?
I am well. It is so great to have you joining me again with all of your expertise. So let's go ahead and just dive into this conversation because again, as I mentioned, fibroids is something that affects women of color more than it affects any other race. So what exactly is, if this is somebody's first time hearing the word fibroids or, really diving into what it is, what exactly are fibroids?
Jackie, fibroids are a term that's often used just to talk about abnormalities, things that are wrong. It just doesn't feel good. But really what they are, Jackie, are tumors. They're benign, non-cancerous tumors. They're growths of tissue that grow uncontrollably to large sizes, and they cause complications. They cause pain and bleeding, and we'll get into that, but they're tumors.
Now, how common are fibroids among women of color?
Probably 80% of women of color will have fibroids by the time they turn age 50, believe it or not. Some of them are symptomatic, some are not. But I guarantee you, if we were to take any room that you go into, count 10 women of color, at least 7 to 8 will have either a small fibroid, either a symptomatic fibroid, or have someone in their family who has had fibroids, which means that they may be susceptible to fibroids sometime in the near future. So they're very, very common, Jackie.
So if they're so common, why is it so important for us to really know about them and dive into them? Because it's a common thing. When you hear about things that are common, it's just like, oh, well, it's not that big of a deal. It's something I can live with. Why is this such an important topic when we're talking about fibroids?
Well, it's interesting that you bring that up at this time in June. Why do we need to talk about it? One of the reasons is July is Fibroid Awareness Month. This is the perfect time to talk about why are we talking about this thing that happens that's so common. And the reason why is because it affects so many women. And the effect is not just, oh, sometimes my cycle is heavy, sometimes I have a little pain. These things are taking people out of work. You can't go to school. You can't take care of your family. You can't go on trips. You can't wear white. Now, that's a very common thing to be able to wear white, but these fibroids are really interfering with women's quality of life, especially women of color.
Yeah. And why women of color, and we kind of talked about this a little bit more, but you talked about why women of color more than other races. Is it a hereditary thing? Is it something that is passed from mom to grandmother or from grandmother to mom to daughter?
It's interesting that you bring that up, Jackie, because one of the things that I do when I talk to patients is I ask about family members. I asked if mom has had anything going on. So I had a patient today, came into the office and said, hey, I have these uterine fibroids, doc. I mean, she waited a while to get them taken care of. They were like this big. And she needed care. She came to the right place because we're going to take care of them. However, I asked a question. I said, ma'am, tell me about your mom's menstrual cycle. Well, I don't know, doc. She had a hysterectomy. Do you know why? We didn't talk about why. I know she had a hysterectomy. What about your sisters? Well, I have a sister that has fibroids. And I asked a very important question. I said, do you have any children? She said, yes, I have 3 girls. I said, what do you think is going to happen to them at some point if everyone else in your family has had fibroids? And she put her head down and said, they'll have fibroids too. I said, yes, but they'll only be a problem if you don't talk to her about the genetic predisposition of fibroids and how they're transferred through families and genetics.
Yeah, great point. The last time we talked, that's actually something that I had to have a series. That's something that we kind of talked about with me.
Yeah, I remember.
It is a history. It's something that my grandmother and my mother have both experienced. And after the conversation that I had with you, I actually had a conversation with my mother about it. Yeah. So
really? That's awesome.
I did. Yeah. We sat down and we were able to talk about it. And she was able to shed a little bit of light on my grandmother's experience. But thank you so much, because again, it was one of those things where I didn't know that it was hereditary. It's something that I could potentially have. And it's something that I need to address with my mom. I think that's one of the things that in the Black community we don't do enough of, is having those real hard conversations. So thank you for just kind of giving me that aha moment of saying like, hey, this is a conversation that you need to have. I had it, and I feel so much better that it's something that's addressed. I can talk to my doctor about it, and it's something that we can keep an eye out on. Speaking of keeping an eye out on it, let's talk about some of the symptoms of fibroids. It could be a little different for everybody. So can you talk to us a little bit about some of the symptoms?
These little tumors, they can grow anywhere in the uterus, and depending upon where they grow, that can kind of determine which symptoms patients experience. For example, if they grow in the back of the uterus, call that posterior, they can push on the spine and cause back pain. They can push on the bowels and cause constipation. If they grow on the top of the uterus where the bladder is, that can cause urinary incontinence, having urinary accidents. If they grow within the lining of the uterus, they can cause heavy menstrual bleeding. So much so that I have some patients who tell me they unfortunately have to wear diapers to control the bleeding. It's so severe. They can also cause preterm delivery and pregnancy complications, in some cases, even infertility. So these are some of the common symptoms that we see and the ones that we treat, and that can be corrected if the fibroids are identified and folks go to providers that can take care of it.
Yeah. Again, it's having the conversation early, not being afraid to have the conversation, awareness, and that early prevention. Again, one of the things that I learned the last time we had a conversation is just being aware and checking in advance. So if it does happen, you can actually take the steps necessary in advance to make sure that they do not get bigger than what they currently are. Again, I just have to say thank you, because the aha moment happened, and it literally has been a sigh of a relief. So thank you, thank you, thank you. Again, I cannot say thank you enough.
I'm just getting chills hearing you say that, because my mantra is having open dialogues about fibroids. And it's the only way to really address the issue amongst families. And it's those intimate groups of people, your family, that you most likely are willing to talk to about bleeding, abnormal bleeding, pain, moms and daughters. You talk to me about it, but that's maybe once a year when you come in for your annual exam. So thank you for sharing that aha moment. I remember it when we talked last, and I was so excited, and I'm still excited to this day.
Yeah, I mean, it's great. Like you said, it's great to have these conversations, because things come out of it, even with the host. I was not expecting to have that moment, but I'm so happy I did. Let's talk a little bit about Capital Region Health and some of the things that you guys have going on. You all are opening a new fibroid center, which is really, really good news. What is it? What services will be provided at the center, and what can people in PG County expect?
So we're very excited about our Fibroid Pelvic Pain Center. And, what we now can offer are all the options that women have had to leave PG County to get treatment for. Some of the latest and greatest procedures are being done at our Fibroid and Pelvic Pain Center. One of the procedures that I do, one of maybe 4 to 7 docs in the state that perform this procedure, can take care of fibroids, eliminate the symptoms, in some cases during the surgery, and patients go home same day, recovery 2 or 3 days, and a lot of these patients just take Motrin or Tylenol for pain control. So we offer a lot of the cutting edge procedures, some of which are done for patients who desire fertility, some of which are done for patients who don't care about fertility, but listen, I want to keep my uterus because I had a patient tell me, God gave it to me and I want to leave here with it. Ma'am, it's yours. You should have that right. Gone are the days when if you have fibroids, you must have a hysterectomy, this procedure where you get cut in that C-section line and you have to have a week to 4 to 5 weeks off. You're in pain. You can't take care of anyone. So what we're doing with our Fibroid Center is trying to provide a comprehensive approach to treating fibroids. So it's not just surgery that we're offering. We're talking about nutrition, because we know weight plays a role in the growth of fibroids. We tend to see patients who have larger BMIs having more complications with fibroids. So we have nutritionists that we work with that can talk to patients about nutrition, getting that overall weight down so we can decrease some of the symptoms of fibroids. And not only surgery and nutrition are keys, there are medications now that we talk to patients about to treat the symptoms associated with fibroids. Some of the newest cutting edge medications we offer patients. So what we're trying to do at our Fibroid Center, UMCAP Regional Health, is we're trying to make sure we have the opportunity to provide every option that patients can receive outside of our community right here at home at UMCAP region.
Yeah, right here in PG County. You do not have to go down the street and around the corner. You can stay in your backyard, which is phenomenal.
Yeah.
You talked a little bit about this a second ago. We think when we hear about fibroids, surgery. That is not necessarily the case. And even if you do have to have surgery, you may not have to stay in the hospital for days on end. So talk about some of this less invasive surgeries that women can get when it comes to having fibroids.
So one of the procedures, well, several of the procedures that we perform, Jackie, involve minimally invasive techniques that you just mentioned. Techniques that don't require a long hospital stay, have decreased post-operative pain, have decreased post-operative recovery time, fewer scars, and patients overall do much better. 80% of the patients that I take care of go home same day. 80% of the patients that I take care of go home same day. Now, there are some patients who require more technically advanced surgery, and they may have to spend the night in the hospital. But that's that other 20%. Gone are the days when patients are in the hospital 3 and 4 days. So we have the ability to treat fibroids in some cases without incisions. No incisions on your belly whatsoever, depending upon where your fibroids are. So these are the options that we have available now. And this is what we're offering patients. And the outcomes are phenomenal. I have patients coming back to me saying, Doc, I was told that I had to have a hysterectomy. And you're telling me that I can come in, you can perform a 20-minute procedure. I can go home an hour later and I can go to work the next day and my bleeding goes back to normal. I say, yes. I say, thank you. I'm telling all my friends. I say, yes, tell them to come and see us.
So it is possible to come in, have a surgery that may not be as invasive and get back to regular life the next day?
The next day. The next day. The thing you're waiting for is your anesthesia to wear off. So you may be sleepy that day, but as far as pain, menstrual-like cramping, that's about it. As far as bleeding, maybe spotting like the last day of a cycle, but nothing significant where it's going to interfere with your ability to go to work, go to school, go on vacation, take care of your family. That's where we are now. Mm-hmm. And the important thing is folks need to know. So I appreciate this opportunity to share this with the women of Prince George's County because there are not many avenues like yours, Jackie, where we have the opportunity to share this experience. Because what we do see is every day I have patients coming in and telling me that I never knew this was here. But this venue here is allowing us to get this information out. So thank you for what you do.
No, again, thank you for just shedding light on this. Because, you know, if you didn't come on and shed light, we wouldn't know. Like I said, it happened to me. Like I sat in the very same shoes. If I go in, I have a procedure, you know, for a very long time, I may have been experiencing pain. How long after treatment does it take for the pain to go away? Is it a few weeks, a few days, a few months? Is there a particular time span on that?
It depends on the size of the fibroid. You know, there's some fibroids that cause discomfort that are very small, about the size of a quarter. And believe it or not, these fibroids can cause bleeding that's so significant that I have patients that are changing, you know, products every 30 minutes, soiling. These fibroids I can take care of in our center within 30 minutes, and recovery is pretty much the next day. Now, you mentioned, you know, what can they really expect as far as time and pain? It depends. If the fibers are much larger, let's say about the size of a grape, maybe, you know, to a grape to a cantaloupe, for example, maybe we're looking at about a week.
Okay.
Go ahead.
I was gonna say, time-wise, that's still not terribly bad. A week?
No, it's not. It's not. Now, when we get to the size of a watermelon, I have to be honest with you, we're probably talking about 2 or 3 weeks. recovery, because that's major surgeries, removing a very large tumor. And technology just isn't at the point at which we can remove large tumors that size and have outcomes where we have with this smaller tumors. I will tell you that, some of the patients that I see, a lot of patients come in and they're asking, what do you think, doc? I've been to one doc, I need a second opinion. I want to know what you think. I was told that this couldn't be done. Well, I always say it's time for the good news. And the good news is, in most cases, it can be done. Mm-hmm. Now, I will be honest. Some women, if the fibroids are so large, we can't do anything. If they've grown to a point at which they've taken over the entire uterus and there's nothing left, I tell the patients, hey, your first opinion likely was, what you need to do. And I wouldn't do anything different because it's the safest thing for you. And they said they agree. And then we move on from there. But I get a lot of second opinion patients, and, I enjoy seeing them and educating, just as we're doing today.
So at what point in time, if I get the news that I have fibroids, should I, seek a second opinion? Sometimes we hear this one person tell us one thing, we kind of get stuck on this, or we don't know if we should talk to somebody else because we've never had a conversation with anybody else before. So at what point in time should we say, hey, maybe I should reach out to somebody else and see if I can get a second opinion?
Jackie, what I hear a lot of the times when I see patients for second opinions is that they say, well, doc, I have fibroids. I say, okay, great. What does your doctor say? Well, they said, let's wait until you start having heavy bleeding and you start having heavy pain before we do anything. Take these birth control pills in the meantime. Well, my opinion is, why are we waiting until you're being affected negatively and then we have to do a hysterectomy? No, we don't need to do that. If you have small fibroids, no symptoms whatsoever, at what point should we intervene? Right then and there. Let's measure them. Let's see what size they are. Come back in 6 months. Let's do another ultrasound. Are they growing? If they are, let's jump into that diet and get on nutrition. Let's get this taken care of. Let's be proactive to reduce the risk of having to have these fibroids grow to be a large size where you actually have to have surgery. So what I tell some of my patients that come in is that if you have fibroids and you have a daughter and she is in her 20s, she likely needs a surveillance ultrasound just to see if she has a fibroids. Because, Jackie, sometimes the only time you find out you have these fibroids are when they're big and they're causing problems. You don't know. The new thought in our center is that education is key. So if we can let moms know who are being treated for fibroids, who have daughters who are reproductive age, that to be evaluated, we can intervene earlier and prevent them from having these crazy surgeries. If they don't come to our center, having a surgery somewhere else that may be a little bit more morbid and have them staying out of work and school and all that. So that's what we're doing.
Yeah. And I would have to say that's key is, again, saying something early, moms and daughters and grandmothers having those conversations. So like you said, that early detection, if there is something there, we can start to work through this thing early versus waiting until it gets too big. And then a surgery is necessary. The last time we talked, I specifically told you my mom, I remember her fibroid story. I remember her telling me, I remember the day she told me. I remember her she was having severe pain. Mm-hmm. And she kept taking days off of work and I couldn't understand why. Yeah. And then maybe like a week or two before she actually had surgery, she told me, and she didn't tell me in advance because she didn't tell me too far in advance because she didn't want me to be seriously worried. But I remember when she had the fibroids taken out and them telling me, my brothers and my dad that, it was the size of like a cantaloupe.
Yeah.
Like it was big. And it was one of those things where she was in the same situation if she didn't have the conversation with her mom. And it was, oh, well, you know what? Don't worry about this until it gets super, super painful. And by the time it got super, super painful, it was just too late.
Yep. Yeah. So early identification is key, I think.
Yeah, most definitely. So say something if you're watching this, go ahead and have that conversation with your doctor now so that the early prevention can start happening now. I say this because I have done it. And when I tell you a sigh of relief, because I do not want to, my mother said that having her fibroids removed was worse than giving birth. And I never want to have to go through that if I don't have to. So again, just that early detection and having those conversations with my mom, as well as with my doctor, has made a world of difference in my life personally. So please, like,
beautiful story.
It's a history in your family. Go ahead and have that conversation. We've been talking a lot about fibroids. Let's talk about endometriosis real quick. How are the two similar? Are they similar? What's the difference between the two?
Sometimes they exist together. I have patients who come in with pain who have fibroids, and I go in to do a fibroid surgery, and then lo and behold, there's endometriosis there. Endometriosis is a condition that causes heavy pain, significant pain. Doesn't cause bleeding, but it can cause debilitating pain, so much so that you're hunched over during the menstrual cycle. It hurts to have a bowel movement sometimes. You can have pain during intercourse. It may hurt when you empty your bladder, and it just may hurt periodically during the month. It's a pain syndrome. It's sort of one of those things where I'll deal with it as long as I can, and then I'll try to take pain medicine to treat it. Unfortunately, a lot of pain medicine doesn't really work the way we want it to work. There are medications on the market that can treat endometriosis, this painful syndrome, but in most cases, it has to be removed. Mm-hmm. Now, endometriosis, we don't know how it happens. One theory is that during the menstrual cycle, some of the menses comes out onto a tampon, and the rest comes back through the fallopian tubes and lands in the abdomen, and it seeds there. And this is one theory, that endometriosis comes from bleeding, but we really don't know for sure. What we do know is that it's painful, it's debilitating, it causes women to lose days from work, school, and taking care of their family, just as fibroids. But it does not involve tumors. It does not involve heavy bleeding, but it can cause some significant pain. And it doesn't have to occur when you're 20, 30, 40 years old. It can start in your teens. So it's important that moms who have their girls and they have this significant pain be evaluated early. Mm-hmm. Because again, just like fibroids, early detection is key. Endometriosis can occur in stages 1, 2, 3, and 4. And if you can identify something early, your treatment likely will be more effective.
We talked about fibroids being hereditary. Is endometriosis hereditary?
So I have patients who have family members with endometriosis as well. There is a hereditary component there. It's not as clear as it is with fibroids, but yes, I see it in families. So if a mom comes in, I do the same thing. If you have a problem with your pelvis, mom, and someone else in your family has had it, you are obligated to have an open dialogue with your daughter about how she's doing to get her some help. So yeah, I do see endometriosis in families as well as fibroids, yes.
Is there a way that I could prevent endometriosis?
Well, unfortunately, I wish I can say yes. No, the answer actually is no, because we really don't know where this comes from. Another theory is that it occurs during the time that the egg and sperm meet and start growing. We don't know if that happens for sure, but that's another theory. So preventing something that may be in your DNA, like endometriosis, like fibroids, is going to be hard to do.
Mm-hmm. How does endometriosis and fibroids affect pregnancy?
Good question. That's an awesome question. How does endometriosis and fibroids affect pregnancy? Well, we talked a little bit about fibroids, right? We talked about if the fibroid is in the lining of the uterus, that area where the baby goes and gets comfortable and grows for 10 months and gets ready to deliver. If there are tumors or masses in there preventing the baby from resting comfortably, there may be a complication such as preterm labor, such as breech deliveries. All these complications can occur if fibroids are present. When we talk about endometriosis, it's a different fact. You know what happens in most cases with pregnancy, endometriosis gets better. It gets better because the types of hormones that are being released that cause endometriosis flares or pain are not being released at the same level during pregnancy because you're not having a cycle. Your hormones are being released a little bit different. So because pregnancy hormones are released different than non-pregnancy hormones, patients who are pregnant don't have endometriosis pain, but patients who are not pregnant can very well have it every month.
So if I'm pregnant, let's say I have my child and postpartum 3 months, can the endometriosis pain come back?
Once your cycle comes back, it can come back. It's directly correlated to the way hormones are released to cause a cycle to happen. So once the cycle comes back, the pain can come back. It's usually a little bit delayed depending upon whether the mom breastfeeds, because that can delay a regular cycle, but it will come back eventually.
So if I'm in a relationship, I know that I want to have a child at some point in time. At what point in time do I need to, if I have fibroids or if I have endometriosis, should I get the treatment before or after pregnancy? Because, there's a lot of women who, they plan it out. They're like, I'm going to do this in 2 years. If I know that I have fibroids, if I know that I have endometriosis, should I handle this prior to and then go through with the pregnancy, or should I just wait until afterwards?
Two answers. If you have fibroids, it's preferred that you have them taken care of prior to pregnancy.
Okay.
And the reason is because of the complications that we talked about. Depending upon the size of your fibroids, right, it may cause you to have preterm delivery if they're too big. However, if those fibroids are removed, you can prevent preterm delivery from happening. However, depending upon how large they are, it may mean that you can take your pregnancy all the way to term, to your due date, even the week after, but delivery may require a cesarean section because the uterus has an incision in it because we removed the fibroids. That's the fibroid, number one. Number two, with endometriosis, how does that affect pregnancy? Well, sometimes endometriosis can cause scarring in the pelvis. It can cause scarring that can close the fallopian tubes such that they can't reach out to that ovary as they do every month to receive that egg. The egg cannot get in the tube, which means the sperm cannot get to the egg, and there's no fertilization and there's no pregnancy. So endometriosis can cause infertility in some patients if it goes on long enough.
So definitely one of those things where if you know it, go ahead and have those conversations, that early prevention. Let's go ahead and get on top of it. Question, how often does it even happen where fibroids appear during pregnancy?
That's a very good question. I've been doing this for over 20 years, Jackie. And before I became the specialist in fibroids and endometriosis, I did general OB. I was trained as a generalist. And I would see fibroids early in pregnancy, 7-8 weeks. Patient comes in, I do an ultrasound, say, hey, there's your baby's heartbeat, but there's this fibroid the size of a quarter. And we continue to watch the fibroids as the pregnancy continues. About 33% of the time, they stay the same size. Another 33% of the time, they even shrink. But that other third, they get larger. So lucky for us at University of Maryland Capital Region, we have a perinatologist who is prepared and ready when we open our center to follow patients who actually have fibroids, to make sure that we keep an eye on the growth of the baby, to make sure the fibroid is not causing any preterm complications, and just watch moms through their entire pregnancy. So we're really doing a good job at identifying these moms who have fibroids when they're pregnant. And I think that is also key in preventing pregnancy complications.
Mm-hmm. And I want you to just go ahead and clear the air, because I know there will be a few people who are wondering, if I get pregnant and you find out that I have a fibroid, we can't just remove it. I mean, you would remove it if the baby wasn't here. Let's clear up the air. If you have a fibroid while you were pregnant, can it be removed?
No, it cannot be removed without putting your pregnancy at significant risk for ending at that time. If we would cut into the uterus where the baby is growing and resting, that may interfere with the blood supply to the baby and thus cause a miscarriage. And that's the last thing we want to do to a beautiful growing baby. So what we always recommend is that fibroids be taken care of after pregnancy. I even recommend that they be taken care of 3 months after delivery, because that third of patients who's had a larger fibroid grow during their pregnancy, once all those hormones go away, it shrinks to a smaller size. And the surgery isn't as significant. It isn't as big. And sometimes we can even use some of those minimally invasive techniques where patients can go home in an hour and recover the next day once the fibroid shrinks.
Thank you for clearing the air, because I know somebody was thinking, well, I could just have it removed in the early stages of my pregnancy.
No, ma'am. No, ma'am.
It does not work like that at all. It has to happen either before or after. And if you're in this little space, honey, you're just gonna have to sit and wait, okay?
Yeah, we'll watch you. We'll take care of it. We'll make sure that, we pay close attention to complications. We know how they arise. We can do imaging studies to make sure we keep an eye on the fibroids growth. But it's just important to know that, one, these should be taken care of prior to pregnancy. And if you do become pregnant, just know that we can follow you. And it doesn't mean that your pregnancy is going to be complicated necessarily. It just means that we need to pay put a closer eye on you and pay more attention to you as you continue your pregnancy.
For any expecting mothers who currently have fibroids, or mothers that are thinking about having a child, and may get the diagnosis that they do have fibroids, are there any extra precautions or any extra things that they need to do outside of, having a team around them to monitor to make sure that the fibroids aren't causing any complications that they need to do or should be doing?
I think just being aware that you need to be in the hands of a perinatologist, that is a maternal fetal medicine specialist, a OBGYN who specializes in all complications associated with pregnancy. Having that person on board is probably all you need to do. The fibroids presence is genetic. It's not as though you had too many, milkshakes, or you ate bad, or you ate too much cake, and then now you have fibroid. The fibroid is going to be there. So there's not a lot you can do about that. However, being followed by a perinatologist, I think, is key once you become pregnant.
Mm-hmm. Stress. Does stress play a factor in fibroids? I know a lot of people are stressed these days, so kind of just want to get some insight on that.
Sure. So I haven't seen any studies, any trials that show that stress causes an increase in growth in fibroids. That would, to me, would suggest that if you're calm and you have fibroids, they may not grow as fast. Mm-hmm. But there is a connection between stress and fibroid growth. Indirectly, if you're stressed and you're a stress eater and you eat more and put more weight on, you can see your fibroids grow. If you're stressed and you're not a stress eater, you don't eat when you're stressed, and you lose weight, you can see a decrease in the size of fibroids because they're, in some cases, directly related to overall weight. Yeah.
So try to manage your stress. I think that's something we can all take away from this.
Yes.
And as a personal trainer, try not to overeat. Please and thank you. I know life is gonna life.
Yes.
But there are a lot of things, as you mentioned, that come along with extra weight. So if you can keep the weight down as best as possible, please do that. It does make a world of difference. Dr. Stitt, thank you again so much for just taking a few seconds out of your day to chat with me and PG County, the entire DMV, about fibroids. Why is it so important? Endometriosis. July, like you said, is Fibroid Awareness Month.
Yes, ma'am.
It's something that we need to address. It's something that we need to talk about, especially in the Black community. I can't stress that enough. I know what it feels like to actually experience fibroids in my family, and then, have my own concerns about fibroids. So this is a topic that is very near and dear to my heart. So again, thank you for speaking with me, to PG County, the entire DMV. It literally means the world to me. And I know somebody is getting some great information right now.
Well, thank you for this opportunity, Jackie. It's always a pleasure coming on your show. You're a gracious host. I love sharing my experience with the women of Prince George's County and whoever's listening, because I think it's key to get this information. All I would ask is that everyone remembers that July is Fibroid Awareness Month. Talk to one person about fibroids and see their response.
Dr. Stitt, before I let you go, I have to ask, if somebody wants to reach out to you to get more information, pick your brain, they may want to even schedule an appointment at this point. How can they do that?
I would be honored to take those calls. And we have two locations where we have our Fibroid Center for Pelvic Pain. One is National Harbor. The other is Laurel. The phone number is 301-686-3404. It's 301-686-3404. 3404, Laurel or National Harbor locations. It's important to know that these locations, I have patients coming from Bowie, from all over to my Laurel office. I have patients coming from Southern Maryland, Easton, Suitland to my National Harbor office. So we're open. We make accommodations for those that are traveling, and we'd love to see you.
PG County, Dr. O. Lawrence Stitt III, board certified OBGYN and director of minimally invasive gynecologic surgery and director of the Fibroid and Pelvic Pain Center at Capital Region Health. Thank you, thank you, thank you again. I so appreciate you. And hopefully I pray that the floodgates open to your office and you are just helping a lot of women, a slew of women when it comes to fibroids and endometriosis. This is something that can be prevented. It's something that can be treated. You just have to open up and talk about it and know that you're not in this alone, okay? You can do this. You can get through this. I say that again because having Dr. Stitt here to talk to me about it has literally like put a team of people around me, a support system of people around me so that I feel comfortable with my, and not, I don't have fibroids, fingers crossed, I never get them, but you know, I have a team and a support system around me so that I can monitor myself and they can monitor me to make sure that, you know, I'm living my best life. So thank you again.
Thank you.
And this has been another edition of Girl Talk Live.